We have new data that offers an even clearer picture of what local measles vaccination rates look like. Last month, the News 4i team told you about the rising number of parents opting out of vaccinations for their children, leaving some communities vulnerable to outbreaks. Now a partnership with NBC News and Stanford University goes more in depth to examine the vaccine divide that's happening here and across the country. Investigative reporter Tracee Wilkins joins us for more context.
Through our interactive map, now up on NBC Washington, you can see where our vaccination rates stand and which areas are opting out. First, the good news that's coming out of the District of Columbia, where D.C. is seeing a surge in the number of people who are getting their MMR vaccination. This is the highest rate in 5 years, with 93% of kindergartners vaccinated. That number also represents one of the highest surges for vaccinations in the nation, with a 14-point jump since 2019. A move the D.C. Health Department says was done by reaching out to parents through robocalls and mailers and bringing vaccines directly to families with mobile health units, pharmacies, urgent care centers, and school-based clinics. But exemptions in D.C. are on the rise, too, from 0.43% in 2019 to 2.71% last school year, over 5 times higher than before. And while vaccination rates are increasing in the district, we're seeing a much different story across the river in Alexandria City, where they saw a dramatic decrease in its vaccination rates, falling from 95% in 2019 to only 88% last year, well below the 95% threshold needed for herd immunity to prevent a measles outbreak and stop the disease from spreading in a community. We reached out to the Alexandria Health Department, which tells us it doesn't have a single clear explanation for the decline in public school immunization rates, but adds it is closely monitoring trends and partnering with ACPS to take a deeper look at the data to better understand the changes. But Alexandria is an outlier in Northern Virginia. Fairfax County, Prince William, Loudoun, and Arlington are all at 90% and higher with their vaccination rates. Same is true in Maryland. This is what we saw with Montgomery and Prince George's counties. They're both at 95% or higher for their MMR vaccinations, a significant jump from Montgomery County that was at 63% during the pandemic. This is why early vaccination numbers matter.
So we could slip if there's enough vaccine skepticism or hesitancy, which I don't expect in Maryland at a large scale, but we are seeing undermining of public trust in vaccines in general, and the measles vaccine in particular. One could imagine a scenario where fewer and fewer children are getting vaccinated, particularly in some communities. And then those communities are going to be at higher risk for an outbreak. This is something you have to continually work on. This isn't a one-off thing where you achieve high measles vaccine coverage, you're good to go, because there are continued, children being born and growing up in the United States everywhere, and they are susceptible to measles until they get vaccinated.
For the last 6 months, the NBC News Health and Medical Unit, in collaboration with Stanford University, also looked at MMR vaccination rates in every county across the country and found that 77% of counties and jurisdictions in the U.S. have seen a drop in their vaccination rates since 2019, while exemptions have increased, with more than half of counties reporting exemption rates more than double from their first year of data collection to their most recent. And we're already seeing a real-world consequence because of those stats. This year, measles cases in the U.S. have reached their highest level in over 3 decades. 3 people have died, and more than 1,400 have gotten sick. At the same time, the political landscape around vaccines is shifting. Health and Human Services Secretary Robert F. Kennedy Jr. has fired the CDC director and is overhauling the panel that decides which vaccines are recommended for Americans. Now, some health leaders and politicians fear his anti-vaccine views are influencing policy at the state level, with Florida becoming the first state to end all vaccine mandates, a move critics warn could cost lives. In response, Democratic-led states like Washington, California, and Oregon are forming their own health alliance, working together to coordinate vaccine guidance independently of the federal government. For a closer look at the vaccine divide and the interactive map, you can head to our website or NBC Washington app. I'm Tracee Wilkins with the News 4 I-Team.
Our thanks to Tracee. While our area has not formed a health alliance on vaccine guidance with other states, the governor of Maryland recently signed legislation to protect vaccine access, requiring insurance providers to cover the cost of vaccines recommended by the Advisory Committee on Immunization Practices.